The third question, Assalamu alaikum, Sultan Salahuddin, place Chennai, India. My question, is it permissible for an asthmatic patient to use inhaler while fasting? If a person is suffering from asthma and if he uses the puffer or the inhaler, there is unanimous agreement between all the fuqahas and all the scholars that it does not break your fast. Because when you use inhaler or a puffer, there is a compressed air which you put into your mouth, it goes to your throat, and from the throat it enters into your lungs. It does not enter into your stomach. So because of that, your fast is not broken. Even if you use a mask having oxygen in the situation of asthma and you breathe, that too does not break the fast because it doesn't enter your stomach, it mainly goes to your lungs. But there are certain treatments in asthma, for example vaporizers, where there may be some medicine put and there's pressure of air, and if that medicine goes while going into your lungs, there are chances that some portion may go into your stomach. Or suppose the capsule is put into an equipment with compressed air and this capsule is mainly containing powder. So there are high chances that the powder can mix into your saliva and from that it can go into your stomach. So because there are chances in such type of tablets or capsules or vaporizers, this sort of treatment for asthma, it is preferable to do it before the time of fast starts or after it ends. If it's a must that you have to take it in between, then you can break your fast and keep it afterwards, after Ramadan. Or if you have to take it throughout your life, then what you can do is you can feed one poor person for every fast you have missed. Hope that answers the question.